I had always had irregular periods, and it was just kind of something I was almost used to, and they became more irregular and with really heavy bleeding.
It was a normal thing for me that I will bleed heavily on my menstrual cycles. So I did not know anything was going wrong.
Well, I had a period, and a woman of 60 should not have a period.
I was having a period, but it would last for like 2 to 3 weeks at a time. And so I asked some older people, did they experience that while going through menopause? And they were like, oh yeah, you're fine. You're just, everybody goes through it differently. So I thought that it was a part of menopause. I didn't know that it was a part of endometrial cancer.
Endometrial cancer, also known as uterine cancer, originates in the endometrium, which is the inner lining of the uterus. It is the most common cancer of the female reproductive organs. The disease affects more than 50,000 women in the U.S. each year. There are close to 1 million endometrial cancer survivors in the U.S.
If you have to have cancer, this is a good one to have because normally it presents early with symptoms, and the most common would be postmenopausal bleeding.
The average age is probably between 60 and 65, so it is definitely a cancer generally of postmenopausal patients, but that really ranges. We've had patients who've been in their 80s and 90s, and we've had patients who've been in their 20s.
Endometrial cancer can be diagnosed with a simple office endometrial biopsy or outpatient procedure known as a D&C. Early detection is very important and will increase the chance of a complete cure.
When the test came back, he called me at home, and that was the worst feeling ever. It's hitting me now. And he let me know that it was cancer and that I needed to get with an oncologist right away.
It was very scary. It was very scary because I was pretty healthy. I exercised every day. I ate healthy.
After receiving a diagnosis of endometrial cancer or any other cancer of the female reproductive system, patients should be referred to a gynecologic oncologist for treatment.
So we do feel strongly that being treated by a gynecologic oncologist for endometrial cancer really does lead to the best patient outcomes. It's critically important because gynecologic oncologists are really the only type of surgeons who are prepared and trained in order to do the full cancer staging should that be necessary.
Most women who are diagnosed with endometrial cancer, we're going to recommend surgery for them. And so that means a hysterectomy, which is the removal of the uterus and the cervix.
While most women with endometrial cancer will have surgery, others may require chemotherapy or radiation treatments. Gynecologic oncologists are able to tailor a treatment plan appropriate for each patient.
If it's a woman who's diagnosed who wants to preserve fertility, then that's a special category, and there are certainly options for that.
My treatment was a little bit different from traditional treatment for endometrial cancer. My doctor started with a D&C procedure and then gave me an IUD birth control that stayed with me, and that was essentially my treatment.
Just as important as knowing what to expect from your cancer treatment is learning how to live and thrive as an endometrial cancer survivor.
That day that I had the bleeding, that scared me witless. And it was a wake-up call. And starting that day, I started making changes to my lifestyle. So when my primary care physician weighed me, it was 52 pounds ago. And by the time I went to see the gynecologist, I had already lost 5 pounds.
Obesity can be a risk factor for endometrial cancer and can have an impact on cancer treatment options and recurrence risk. Other important risk factors for endometrial cancer include family history, diabetes, and decreased physical activity. Obesity can affect your quality of life and is a risk factor for other life-threatening conditions, such as hypertension, heart disease, and diabetes.
That you can actually, go on the computer to find out what your BMI is, which is your body mass index, and it's basically a correlation between your height and your weight, and it gives us sort of a range of what a healthy weight should be. And in general, a BMI over 25 is considered overweight, and once you reach a BMI over 30, it's considered more obese.
I had always struggled with my weight, and I was probably about 50 pounds heavier then than I am right now. And when my doctor was explaining this kind of non-traditional endometrial cancer treatment, she said, anything you can do to lose weight is going to help you.
I gained a lot of weight doing chemotherapy. I gained up to 199 pounds, which is the heaviest I had ever been. So I signed up for the weight management program that was available to me, and I lost 30 pounds doing that.
I think probably the most important thing to remember when you're losing weight is that it's not a temporary crash diet that you're going to do for a while and starve yourself, finish that, and then go back to normal. It's a lifelong process, and it's a lifelong philosophy that if I really want to be healthy, I need to change the way I'm eating and change the way I'm exercising.
Endometrial cancer survivors are advised to eat a healthy diet comprised of mostly vegetables, lean proteins, and fruits. Monitoring your intake with a food diary or online tracker can help. Increasing physical activity, such as walking, biking, or other low-impact exercises, can help you feel better mentally and burn more calories.
I have family and friends who were going through their own weight loss at the time too, so that helped. I had friends who went walking with me. I had friends who encouraged me to do a race with them and start running with them. I had my friends and family recognize when we were going out to eat or having me over to eat that I was going to be paying more attention to what I was eating.
I do a lot of meals with squash. I found that I love butter squash. I sometimes substitute that instead of a sweet potato. I use a butter squash. I change up one thing, so a lot of my meals is mostly vegetables.
The sense of accomplishment was phenomenal, and I knew I was doing something to help myself, so that was really wonderful. Because I was doing chemo at the same time and there are side effects from the chemo, I suspect the side effects from the chemo would have been much more severe if I hadn't had the endorphins and if I was carrying around the extra weight.
Developing good eating and activity habits and working to achieve a healthier weight needs to be part of any cancer survivor's self-care plan. And having the support of family and friends plays an important role in maintaining a healthy lifestyle.
Thank God for my husband, for having him there, for the support he has given me through all of this. He is a true hero, because everything that he had to go through before, during, and after, you know, he is my Superman.
Women who have had endometrial cancer are encouraged to share what they know about the disease. They can be a resource for other women who might be at risk for this cancer.
Women who have endometrial cancer are often the centers of their families. They're the mothers, they're the daughters, they're the sisters, and they have a group of other women who are going to turn to them and say, hey, what was your experience and what happened?
I believe that if you have any type of symptom that is not, feeling right, if you're bleeding extra, or if you're having pain down there, or even pain during intercourse, get checked out. Get checked out. It's important.
Schedule an appointment with your doctor when unusual symptoms, such as irregular bleeding or pain, present themselves. And seek treatment from a gynecologic oncologist for any cancer of the female reproductive system.
It's not an ending sentence. Do everything your doctor needs you to do. Keep your doctor's appointments and get better, because you can get better.
Endometrial cancer survivors who know what they need to do to stay healthy, and do it, can decrease their chances for additional health concerns and start on the pathway to a rewarding life after cancer.
Now I know.
Now I know.
Now I know.
Now I know.